Kathy, as you say, it's a truly troubling landmark, this, that care home deaths in Scotland are now overtaken hospital deaths for the first time. And it is possible, if not likely, that the rest of the UK will soon follow. It's just that the Scottish data is that bit more up to date. And that's because across the UK, hospital deaths are falling as care home deaths are rising. And this invites a number of questions, but two in particular. Do we know the true scale of coronavirus deaths in care homes? And was every measure taken at the earliest possible time to protect those elderly, vulnerable residents who we knew were so at risk? A pivotal point in this crisis, as Scotland's First Minister announced there were more coronavirus deaths in Scottish care homes last week than hospitals.
In the past week, on its own, more than half of all COVID-related deaths, 338 of the total, were in care homes. And that partly reflects the fact that COVID-19 deaths in hospital do now seem to be declining.
For weeks, care homes have been reporting heartbreaking numbers of fatalities. 16 at this care home near Glasgow earlier in April, 16 at a home in County Durham. No longer outliers, this is becoming routine. Research suggests there's around 3 weeks between someone getting infected and their death. 3 weeks ago, this Renfrewshire care home says they were relying on PPE donated by the public.
They seem to have our back, even though no one else has.
And crying out for tests. Now the Scottish Government says it aims to provide both. Could anything have made a difference, do you think? Could anything have stopped those people dying here?
We keep asking ourselves that all the time, and we don't feel there's anything that could have changed what happened. We don't know how the virus got into the home. Could have been through a resident, could have been through a staff member, could have been through one of these people that they talk about who are not showing symptoms but are carrying the virus. We're never going to know that.
The trend in Scotland raises worrying questions for the rest of the UK. The weekly Scottish data on care home deaths is around a week ahead of the equivalent for England and Wales. We've been reporting allegations that in the absence of much testing, some suspected COVID-19 deaths in care homes have been certified by GPs under other common conditions. You might also look at the number of excess deaths, the number of people who died in a given week this year compared to the number who died in the same week, on average, over the last 5 years. Now, those figures also raise questions about just what the true scale of the coronavirus death toll in care homes might be. In Scotland last week, there were 743 more deaths than average. 87 of those were unexplained by COVID-19. In other words, 12% of the excess deaths were apparently not linked to coronavirus. In Scotland, the week before, there were 197 excess deaths unexplained by COVID-19. So 23% of the number of deaths, more than average, were apparently not linked to coronavirus. In England and Wales that week, there were more than 3,000 excess deaths unexplained by COVID-19, mostly at home or in care homes. So 26% of the excess deaths were apparently not linked to coronavirus. What is actually causing those excess deaths is now a most urgent question. In the Commons, Labour leader Keir Starmer asked about PPE, about testing in England's care homes, and for an explanation for rising deaths. Standing in for Boris Johnson, this was Dominic Raab's reply.
The principal challenge in care homes, unlike in the NHS setting where we've made such good progress, is the greater challenge from a decentralised basis in terms of exercising control over the ebb and flow of people into those care homes.
As hospital deaths fall, care homes are high priority across the UK as deaths are rising. But did it have to be this way?
Residents and staff at care homes in England are now entitled to a coronavirus test, whether or not they're showing symptoms. Ministers have acknowledged the scale of the care home crisis, claiming it was a challenge we must grip and can grip. But the impact on the wider health service is also becoming apparent, with warnings that thousands of cancer patients could die because of delays in getting diagnosis and treatment. Here's our chief correspondent, Alex Thompson.
With wider counting of care home deaths in England for the first time, the death figures were going to jump, and they did. past 26,000, though because of the lack of testing for so long, that figure may still be a serious underestimate. The UK now has in effect two epidemics. In care homes it's intense and showing no signs of waning. Among the rest of us, a slowly declining death rate, though still more than 760 in England in the past 24 hours. Or as this government press conference graph tonight put it, the UK may be en route to being the worst in Europe for COVID-19 deaths. Critically, on testing, just over 50,000 were conducted yesterday, but the government's promised to double that to 100,000 a day by the end of the month, otherwise known as tomorrow. But on care home testing, an admission that delivery isn't keeping pace with promises.
We have obviously had a distribution issue. There's no sugarcoating the challenge we've had with that. We've helped deliver them through the Local Resilience Forum. We are getting the Clipper service up and running, and the military have also done an exceptional job. So whether it's the supply, which we're ramping up in the way I've described and that the Health Secretary has explained, or the delivery, we're doing everything that we possibly can.
A fortnight ago, we visited a care home in Tor Bay. The desperate plea then was for protective equipment and testing. A fortnight on, the owner says both situations remain dire despite daily press conference pledges from the government. Take testing.
We have a lot of evidence that where the testing is available and has been done, the results have been in some cases lost. In some cases, the wrong test has been delivered. The results often are not delivered in timely fashion. Many results don't come back at all, as in our case.
A fortnight ago in Devon, the care home was dangerously short of PPE, protective equipment for staff. So were many such homes in the area, we were told.
In terms of PPE, absolutely nothing has changed. We are still begging PPE from our local authority, and we can only take 3 days' supply. A lot of the product we need is not available, and we are trying to buy it from every source we can find it from.
Away from the immediate storm of COVID response in hospitals, a shockwave has rippled through other areas of medicine, cancer and heart disease. Research out today suggests the pandemic is damaging other treatments. There's been a drop of 76% in urgent referrals from GPs for suspected cancer patients. And chemotherapy appointments for cancer patients have fallen by 60%. The result? We could see nearly 18,000 more cancer deaths over the next year than without coronavirus. That's about a fifth more than would otherwise be expected.
That we now have good services that will allow people not to be under the risk of COVID-19 infection. So it's really important that if you're finding a new lump or you're losing weight, if you're bleeding from somewhere, you need to be going to your GP.
Clear medical advice there for the general population, but for the care home residents, this was the day when the government finally admitted it hasn't delivered on promises to the care home sector. As Dominic Raab himself put it, there is no sugarcoating that.
Well, joining me now is the former Pensions Minister, Baroness Altman, who now campaigns on issues surrounding social care, and Vic Rayner, who's Executive Director of the National Care Forum. Vic Rayner first. We've had this awful jump again in the death toll figures. Now care homes are included. Are we getting to the true scale of the crisis, or do you fear that the real figure is actually much worse?
Well, I mean, I think it's very important that we now have this data and it's being included. I'm delighted in those daily figures, because what's very, very clear is that level of data, that knowledge about what's actually happening is the only way that change is being driven. I think having access to those figures is hugely important, not only because it's driving some government change, but it's also recognising that the very significant loss of those families and the loss of residents within those homes.
Baroness I just wanted to Altman, can I just put that to Baroness Altman? We're clearly seeing now the scale of this tragedy emerging. Was it a preventable tragedy in your view?
Well, I think this is an extension of the problem we've had with social care for years, in that it tends to be an afterthought. It's the second-class service when it comes to health and care. And yes, we knew right at the start that the majority of people who were dying from this were the older generations. And we knew that those who had compromised immune systems or other problems were more likely to suffer fatalities or serious impacts. And we also knew where the most vulnerable of those people actually were, because they are in care homes, they can't live independently, or they're having care at home, again, because they can't live independently. But unfortunately, because they're not part of the NHS seemed not to focus on them.
Right.
And that is a real problem that we must deal with.
Well, the Health Secretary has insisted that care homes were front of mind right the way along. But Vic Rayner, I just wondered if I could ask you, you saw in that piece from Alex that there was still a continuing problem with both protective equipment and testing in the care home in Torbay. Is that something that's reflected across your membership?
Yes, it is. I mean, I think the challenges around access to PPE, both getting the right stock that you need and at the level of supply that you need, is hugely challenging for many homes across the country, and that has to change. I mean, the sort of make do and mend approach to PPE that seemed to dominate much of the care sector's access to PPE at the beginning of this outbreak just has to end now, and we have to get that PPE out. In relation to testing, whilst we recognise that these are new systems that are coming into play, I think the level of access to testing for both staff and for residents has to be the number one priority for government, and we have to make sure that where testing is available, that social care staff are absolutely prioritised. I mean, we've had the opening up of the testing system to a much wider range of individuals, and I think that there is a real risk that we're concentrating on the target of the number of tests to be completed rather than the real prize, which is to understand and get the testing right for the people who are the priority, which in this instance has to be those care staff and residents.
Just very briefly, what can be done right now, or is it really too late to minimise the tragedy?
No, not at all. I mean, I think there's lots of things that we can be doing now, and we must do them. One of them is using the data properly to drive change and to make us understand what's happening. We need to get expert clinicians and health support into those care homes so that we really understand how the virus manifests within those homes.
Seconded from the NHS, perhaps?
Some of those could be seconded. They could be on expertise coming in from those acute settings which have been watching how the virus manifests itself amongst older people and getting that expert advice out there.
Right.
And I think getting the funding and resourcing right for those care homes so they can do the absolute best that they can to ensure that people have the right treatment at the right time and get all the care and support they need.
Baroness Altman, just standing back, if you can, I mean, we're in the thick of this, but what does what we're hearing, what we're learning, say about how society still treats the eldest and most vulnerable?
Well, sadly, this is a symptom of the ageism that still permeates thinking. And what I think we need to bear in mind here is that the majority of our care homes are run by private companies. But that shouldn't matter when we've got a national health emergency. And if there's one thing we can learn from this, I think it is when it comes to health and care, we need an integrated national service so that the National Health Service looks after social care as well, because these are still people in the system, staff in the system who are not being protected as well as they could or should be. And the government is waking up to it, but we need to get on with it.